In this video, we are talking about infant stretches for the trunk. Now, this video is specifically going over a positional release called total motion release, and it is for all of my proactive parents who are looking to help their littles with rolling, sitting, crawling, and walking, because mobility and flexibility in our trunk influence all of those really exciting gross motor milestones that we are so excited about. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we help proactive parents learn how to help their babies move with confidence and ease. Think of me as your pediatric physical therapy bestie, here to help you learn tips and tricks to help your littles move better. We are talking about one of my absolute favorite mobility technique. This is gonna help with things like rolling, sitting, crawling, and even walking, because if we're really tight and tense through our trunk, then we're not gonna be able to do the things that we want to do, or we're gonna get really frustrated and have a hard time, which is frustrating for both the baby as well as the parent. One of the things I really want to talk about with this video specifically is that this position is a positional release. It's going to be different than traditional trunk stretches for your infant. Stretching is pulling on a tissue to elongate it. Oftentimes we feel that stretch in our body, and as adults we can calm ourselves down, say it's okay to feel this stretch, to feel this tension. I know my body is safe. But a lot of times infants aren't able to do the same thing because their brains are still developing. Sometimes stretches where you pull on the tissue and produce that tension can feel uncomfortable for littles, and then they can tense up accidentally or unintentionally, making that stretch less effective. So traditional stretching is one path we can take to get to our destination, which is that our babies move well and are flexible and comfortable in their little bodies. Think of it as like two routes to get to the same destination. You're going on a road trip and you could take path A, which Google Maps says takes a little bit longer, or you can take path B, which Google Maps says is totally the quickest and also easiest route. That is going to be total motion release. It goes into the direction of ease, so it's going to be easier for babies to tolerate. It is comfortable for them. You're going to follow it up with a vestibular type of motion, usually bouncing. One of the reasons why I love this specific technique we're going to go over today is because parents get to sit down. Sometimes their littles are really heavy, and that can make our arms so tired when we're holding them for a prolonged period of time in these positional releases. So if you want more information on total motion release as a technique, make sure you check out this video up above. Basically, this technique, you are only gonna go into one direction. Traditional stretching, you're gonna do both. Positional releases, you're only gonna go to one direction. It's always gonna be the easiest direction for the baby to go in. You're never gonna hold against their resistance. You're gonna let them move out of it if they need to, and you're always gonna follow it up with 30 seconds to a minute of bouncing or some type of vestibular activity. If your little is able to jump on the ground or bounce on the ground with you holding them, that is another option. You can also have them bounce on a stability ball while you're holding them in a seated position, or you can bounce them in your arms or on your legs. Again, total motion release works by relaxing the tissue so that it is allowed to elongate. Think of it like putting your shirt tucked into your body. You're not going to be able to go in the opposite direction. So if I want to rotate to the left, but my right side muscle is tight, or my shirt is tucked into my pants, it's not going to be super easy for me to go to the left. So you want to make sure that your baby can move fluidly in both directions. And that's how they're going to be able to do those things that they really want to, like rolling, crawling, sitting, walking. If your little is in the rolling milestone, one resource that I want to make sure that you know about is my book, Tummy Time and Learning to Roll. This book is available on Amazon. It is linked in the pinned comment as well as in the description. and it is going to have 240 photos of all of the play positions that are gonna help your baby master it, as well as checklists to go through so that you can figure out maybe what is blocking your little from rolling. Now, total motion release is a whole system of helping infants through adults improve their flexibility and their control of their bodies. Check the description down below if you suspect that your little has tightness at all in their body, and find a TMR approved provider, someone who has taken the courses. If I am seeing your little, or we've done an online parent consultation, and I've talked you through some of the screens for this, and we've determined that, hey, there likely is some tightness in your child's body, then you can utilize this video. Otherwise, it's for educational purposes only. Total motion release includes a lot more than just the positional releases. It also includes more higher level tasks. So don't think that just because you're watching this video that your child is receiving total motion release. But if that is something you are interested in, parents and students and other therapists can take the TMR courses. The TMR Taught website is also linked in the description. If you're not sure which direction is easier for your child, make sure you check this video out, and that is going to help you determine if the right side is easier or the left side is easier. We're gonna go over another variation of the upper trunk, lower trunk twist, or the upper trunk rotation, lower trunk rotation combo total motion release exercise. Oh, is that big yawn? So this is great if your kiddo is struggling with the lower trunk portion, or if you're having a hard time getting your hand through. If you haven't seen that exercise, I'll show it to you real quick. But basically, you're going to have one arm underneath the chest, the other arm is gonna go through, the hand is gonna go on the booty, and you're gonna bring this arm back. That produces a counter rotation, so the upper trunk is going to the right and the lower trunk is going to the left, or vice versa. Now, you can do this position, and this position is great, but sometimes these little babes can be kind of heavy. And so you might need a variation or just a different way to do that. And one of the ways to do that is by bringing their pelvis down. So both their knees are going to be facing to the left, and their trunk is going to go to the right. And this is upper trunk right rotation, because the upper trunk is going to the right, and lower trunk left rotation. Now, you do need to be able to test which direction is easiest in order to do this. So I'll make sure to link the test that you can do laying on the back, as well as the test you can do sitting up for your kiddo to determine which direction is best for them. With total motion release, you always want to go and only want to go to the direction that is easiest. All right, so I'm gonna bring, so for right upper trunk rotation, I'm gonna bring my right arm underneath their chest, and my left arm is gonna come across and just hold right here at the pelvis. And then I'm gonna hold him against my chest, and this babe is almost 4 months, so he is about like 3.75 months, and I'm just going to bring my right elbow backwards while holding him steady against me, and his knee is facing the left. I'm gonna bring his chest backwards towards the right to his level of resistance. And then I'm gonna hold this for 2 to 5 minutes. It's really helpful if there's something engaging over to the right, like another friend or a dog or a window. Sometimes the television, if it's on, can help as well, although we do try to limit screen time before kiddos are 2. Yeah, good job. Good job. Hey, you're doing such a good job. Now, after this, you're gonna follow it up with 30 seconds to a minute of bouncing. You can kind of bring him, relax him. You can either hold him like this and do bouncing this way, or if he's on your lap, you can do a little bit of a 30-second horsey ride. Yeah, hi. Hi, hi. So for him, left rotation is actually the side that I would treat such the easier side. So for that, I'm gonna bring my left arm underneath his chest, and I'm going to turn his knees to the right. I'm gonna bring my right hand onto kind of his trunk,
And I'm going to bring my left elbow back, and I can kind of rotate to the left with my trunk, and then we just hang out here. Say hi. Are you so famous? Are you just the cutest baby that ever was? Thanks for being so nice to me. Yeah, you're doing such a good job. Now, in order to keep a kid engaged, I may kind of wiggle my knee or sing songs or make funny noises. You can also, depending on how old they are, if they're a little bit older, you can give them toys, especially like 9 months, 6, 7 months. You can give them toys to hold purposefully, or you can just, use this and kind of have it on your lap and bring it towards this left arm. Try to encourage. Now, I don't want him to lean too much to the left. That's a different plane of motion. I want him to be kind of nice and upright, but if he does lean, that's okay. So now we're kind of holding. You might hold his little fingers. Say, hey, mister, how you doing? If a baby does move out of this position, I always let them. So if he's kind of trying to come this way, he's really relaxed right now. But if he's trying to pull out of that position, I never hold a baby past their tolerance. I will let them, and then I'll try to kind of distract them, maybe give them a little snuggle, and then try to revisit that position. So 2 to 5 minutes. Yeah, you're getting close to nap time. You're doing so good. 2 to 5 minutes is the goal, but if they are fighting it, you may have to do it 10 to 15 times to get that 2 to 5 minutes, and that's okay. That's just data. You have to start somewhere, and then you'll keep going. Yeah, good job. We're going to follow up with 30 seconds to a minute of bouncing. So you're only gonna do the one side, and then you're gonna kind of lock it in with some vestibular input. Yeah, depending on their head control level. You can give them support, or you may not need to. We're kind of in the in-between phases because he's got great head control for a 3, almost 4-month-old, but it's not perfect all the time. So I want to give him a little bit of support back here out of his trunk. When you are done with the positional release portion, it's always best to work on a functional skill next. So that might be tummy time, sideline play, play on the back, or rolling practice. So for babes in kind of this 3 to 4 month range, those are all, or supported sitting like this is great too. What do you think? We're getting close to your nap time next. Yeah?
And that's a wrap, friends. Thank you so much for joining me on this journey where we learned about infant stretches for the trunk so that we can help our littles master all of their movements, right? We want them to be able to roll easily in every direction, sit easily, crawl with their hands and their knees on the ground, and walk so that they can explore their cozy homes filled with love. If you have additional questions, make sure you check the pinned comment, because that's where you're going to be able to schedule an online parent consultation with me, which is one-on-one, 60 minutes. We can talk through any questions you have. And if you need support on this journey to help your littles master their milestones, please make sure you subscribe. And if you're new here, drop a comment below. Answering questions is one of my absolute favorite things to do on this channel. If you are interested in a little bit more, say you found this video and you're like, ooh, but I'm not sure which direction is easier for my baby, make sure you check out this video next. That is gonna help you determine which direction is the baby's direction of ease.